Good afternoon, Chair Rep Curtis Vanderwall, Majority Vice Chair Rep Jamie Thompson, and Minority Vice Chair Rep Karen Whitsett, and members of the committee. My name is Marie Manley. I live in Monroe County. I am a social work student and a mental health advocate in our community. Thank you for the opportunity to speak today in strong support of legislation to fund and pilot mobile, non-police crisis response teams in Monroe County. The legislation I'd like to address is MCL 330-1207, which directs community mental health programs to divert people with serious mental illness, serious emotional disturbance, and or a developmental disability from possible jail incarceration when appropriate. This statute creates a mandate, but it leaves much of the how up to local programs, leading to uneven services across our state. In 2020, the legislature took an important step forward with Public Act 402, which authorized the establishment of crisis stabilization units. These units provide a vital alternative for people in crisis. However, CSUs remain limited in number and underfunded. My proposal is simple. Introduce a new bill to expand and standardize crisis stabilization programs statewide, beginning with Monroe County as the pilot site. This would establish a pathway to sustainable funding, staffing, and training standards, ensuring that crisis stabilization programs are not dependent on county-by-county variations. As for community and advocacy, NAMI Michigan supports expanding CSUs and investing in non-police crisis response. The ACLU of Michigan has consistently warned against over-policing mental health crises. The Detroit NAACP has called for alternatives to police intervention in behavioral health crises, citing racial disparities in outcomes. Governor Gretchen Whitmer's fiscal year 2025 budget includes $193.3 million for certified community and behavioral health clinics, confirming financial feasibility. Republicans often raise concerns about cost and safety, and these concerns are valid, but the evidence shows that mobile crisis programs are safer and more cost-effective. The Sheriff Association of Monroe County has stressed that safety must remain a priority. That concern brings an opportunity for collaboration. Monroe County has already demonstrated this through the SAFE program, which helps protect individuals with autism, Alzheimer's, and PTSD by alerting first responders to their needs. SAFE proves that law enforcement and mental health services can partner effectively. A crisis stabilization pilot would build directly on that momentum. Monroe County is a largely working class and rural community. We face unique barriers, fewer psychiatric providers, limited transportation, and persistent stigma about mental illness. Families end up driving loved ones long distances, calling 911 as a last resort, or watching a loved one cycle between jail and the ER without lasting support. But this is also a racial justice issue. In 2022, a 20-year-old Black man in Detroit living with schizophrenia and experiencing a mental health crisis was killed after police fired at him 38 times. According to the NAACP, Black men are disproportionately harmed in these encounters. This is not only a mental health concern, it is a human rights issue, a matter of dignity, and a test whether our systems will perpetuate oppression or promote equity. The NASW Code of Ethics calls on social workers to challenge injustice and advocate for dignity and worth of all the people. The CSWE competencies emphasize advancing social, racial, and economic justice. Supporting non-police crisis response fulfills these professional mandates. Some legislators may worry about cost, but research shows the opposite. According to a study published in 2000 in the Psychiatric Services Journal by Roger Scott, the average cost per case was $1,520 for mobile crisis program services versus $1,963 for police intervention, saving 23% per case. According to reports from the city of Eugene, research conducted at the University of Oregon, CAHOOTS, also known as Crisis Assistance Helping Out on the Streets, diverts up to 17% of all 911 calls and saves millions annually. While improving outcomes and reducing hospitalizations, it's estimated that with proper funding and support, CAHOOTS could divert 2 times the number of calls they already do. According to the University of Michigan Center for Local, State, and Urban Policy, 72% of local governments reported that law enforcement struggled with recruitment and retention problems. Investing in crisis response is fiscally responsible, and it reduces strain on police already struggling with recruitment and retention. This bill would restore trust between families and the system, reduce the burden on law enforcement and emergency departments. This is a chance for Michigan to lead. Crisis stabilization is a smarter, safer, and more humane alternative to criminalization. Let Monroe County be the model that proves what's possible. With your support, we can build a system that reflects our values: dignity, safety, and justice for all. Chair Vanderwall, Vice Chairs Thompson and Whitsett, and members of the committee, Michigan families deserve care. I urge you to support legislation and to pilot and fund mobile crisis response teams in Monroe County and expand them statewide. Thank you for your time and your commitment to Michigan's most vulnerable residents.